But even if you inject it subcutaneously or you take it orally, it's going to go everywhere in the body. And so it's not as specific as directly injecting into your tendon or into the ligament or into the joint with something that's going to stimulate local healing. Okay.
I have like tennis elbow and some tendonitis in my knee.
Okay.
And the soreness and the aggravation and the inflammation in my knee just won't go away. It's been about a year now. So I've just been trying to figure out how to fix the knee and the elbow, and I came across your videos on BPC-157 and kind of peptides in general.
Yep.
So that's kind of what led me to say, let me see if this works.
What specific questions do you have for me?
Basically, how would I go about getting prescribed something that would help fix, cure, heal my tendon in my knee and my elbow? My elbow's not that big of an issue. It's really the knee.
Okay. So the BPC-157 is available in its oral form over the counter. So you don't need a doctor to tell you to take it, to how to take it. It doesn't need to be prescribed to you, anything like that. So about, I think, a year and a half ago, the oral version got moved to over the counter. You don't need to do the injectable version. We've been using BPC now for 4 years, and we've used both injectable and oral. And I've never really seen a big difference between injectable and oral version in most people. Some people, the oral works better. Some people, the injectable works better. But for most people, they're going to be about equal, and that's also supported in all the animal research that route of administration doesn't really matter. And so whether it's on my YouTube or on my Instagram or whatever else, there's a link for DNA Health, which is the company that we use because they have the arginate form, which is the better form of BPC. So that's the BPC. You can go ahead and you can try that. It works for some people. In some patients, we've had complete resolution of pain. In some patients, we've had no change in pain. And some patients get a little bit better, but not all the way better. Any of the other peptides outside of that, whether it's GHK copper or TB500 or the growth hormone secretagogues, all of those things, they all need to be prescribed by a doctor because, in our opinion, they should be coming from a compounding pharmacy. You can go online and find research chemical peptides. However, that's kind of a play at your own risk, and I do not advise that. And the reason is because those research chemical labs are not what are called GMP facilities, meaning they don't have the standards for ensuring sterility and purity. And we have had a ton of horror stories on people who get infections or really, really weird reactions to peptides, and they go, oh, I'm allergic to BPC-157. In reality, they were allergic to something or had a reaction to something else and not the actual peptide. And there's no guarantee you're getting what you're actually purchasing. Whereas if you're with a compounding pharmacy that is regulated by the FDA, that's a completely different story. And obviously there's going to be higher standards for purity and things like that. So the problem though is that it is, as you know, California is a little stricter on their regulations around compounding pharmacies, supplements, all that type of stuff. And so we're not currently accepting any patients for just remote work for peptides because most of the peptides that we use, we can't even get shipped into California.
Oh, okay.
Yeah. And
so
then
if I wanted to go get that BPC-157 on your site.
That one you can do. That one you can do because it's not from a compounding pharmacy and they do ship to California. The other ones that are injectable from a compounding pharmacy, we can't get into California for the most part. And so you would either need to find a doctor in California who does peptide therapies that uses a California compounding pharmacy, and then that gets around the whole problem and you just go work with another doctor. Or if you still wanted to work with me, we'd have you come out here to Arizona, and I would do what honestly works better than the peptides is that's our PRP injections for the tennis elbow and the tendonitis in the knee.
PRP works better than BPC, yeah?
Hands down, yeah. It's a targeted therapy. Are you familiar with PRP?
I mean, somewhat, yeah.
Okay, so I'll kind of walk you through it a little bit. So PRP stands for platelet-rich plasma. So that's where we draw your blood, we spin it down in a centrifuge, we isolate out the layer that is rich in platelets. Those platelets contain growth factors and cytokines that help stimulate your body's ability to heal by stimulating cells to make more collagen, by stimulating local stem cells to start repair processes, and then also recruiting stem cells that are already in you into that area where we inject it. And so all the peptides can be helpful because they can help your body to repair certain things. But even if you inject it subcutaneously or you take it orally, it's going to go everywhere in the body. And so it's not as specific as directly injecting into your tendon or into the ligament or into the joint with something that's going to stimulate local healing. Most of my practice is the regenerative injections, so the PRP, bone marrow, adipose tissue, all of that stuff, because that works better hands down compared to peptides. We use the peptides as synergists and as adjunctive therapy. It basically helps the regenerative injections to be more effective and for you to get more healing out of the procedure. But it is relatively rare that I will just use peptides on a patient and not do injections because we get better clinical outcomes when we do injections.
Gotcha. Okay. Cool. Maybe I'll have to come out there. I don't know. All right. Well, thanks a lot for your time, man. I really appreciate it and appreciate all the info online too.
Yeah, you're welcome. If you decide you want to work directly with me and come out to Arizona, just give us a call.
Absolutely. Thank you.